The female reproductive system contains various harmless microorganisms. In normal circumstances, they play an important part in protecting the reproductive system from harmful and unwanted yeast and bacteria. Pelvic inflammatory disease, or PID in short, is when an infection by harmful organisms develops and spreads in the female reproductive structures. This can be an infection in the cervix, uterus, fallopian tubes, ovaries, or surrounding pelvic organs. It is caused by the ascending infection of unwanted microorganisms, originating in the vagina and cervix. While some women may be asymptomatic, many experience symptoms such as pain in the lower abdomen and pelvis, fever with or without chills, abnormal uterine bleeding, especially during intercourse or between menstrual cycles, and some may observe abnormal vaginal discharge with foul smell. Core factors that can lead to the development of PID revolve around the introduction of harmful organisms into the female reproductive system. For example, having multiple sexual partners, or being exposed to partners with sexually transmitted disease. Another important factor is poor menstrual hygiene, which creates a suitable environment for harmful organisms to breed and infect the reproductive tract. Generally, clinical diagnosis of PID is the first step. This includes a thorough history and physical exam that can indicate an infection in the pelvis. It is common to use laboratory tests and swabs from the reproductive tract to further confirm and assess the cause of PID. A pregnancy test is also standard practice to rule out any pregnancy-related complications. As for treatment, antibiotics are the first and foremost intervention. The regimen is based on the type of microorganisms causing the infection and the severity of disease. If detected early and treated, PID is reversible and can heal without any complications. However, treatment cannot reverse any damage that might have already occurred in long-standing or recurrent infections. If untreated, PID can lead to some serious health complications. The infection can form an abscess, which is a collection of pus and bacteria. The infection can also spread to the bloodstream and lead to sepsis, which is the infection of the blood circulation. The damage by the infection in the pelvic organs can also lead to the scarring of the tissue, and in some women be the cause of ectopic pregnancies or the improper implant of the fertilized egg, leading ultimately to infertility. With the correct treatment and early intervention, PID is not lethal in itself. However, if left untreated, PID can have lethal subsequent complications. Sepsis, septic shock, and ectopic pregnancies can all be life-threatening complications stemming from PID. Women who experience symptoms of PID are highly recommended to seek medical assistance for management and treatment. With that, we hope you have a better grasp of pelvic inflammatory disease. Grasp Medicine is happy to announce a collaboration with Zamzam Foundation to raise funds towards period poverty. As an important cause of PID in the developing world, the project aims to offer basic menstrual sanitary pads to women in need worldwide. More information in the description below.